there are grave concerns about the state of Gauteng government hospitals and growing support for whistleblower paediatrician Dr Tim De Maayer, who wrote a letter highlighting the shocking conditions at Rahima Moosa Mother and Child Hospital in Coronationville recently. He was suspended after writing that letter, but reinstated after a public outcry. Now, over 130 top health professionals in the province have sent their own letter of support, calling on the Health Minister and the Gauteng Premier to take action over the state of the province's hospitals. I'm joined now by one of the authors of that letter, Professor Rudo Mathivha. She's head of intensive care at Chris Hani Baragwanath Hospital. Prof, thank you so much for joining us. And this letter, first of all, I see that you are calling for any victimization of any healthcare professional who speaks out about the shocking conditions to stop. But you're also calling for a fundamental restructure in how provincial health departments are run. You know, the doctors, the nurses, the top people running and having to operate in those environments are the ones who see the problem. So what changes specifically do you think you need?
Okay, so let's just put things in perspective here. This is not only about Dr. Tim De Maayer. He was the spark that lit this fire. When they touched him, they touched all clinicians. We have been working in a toxic environment for a very long time. And we took an oath not to do any harm to our patients and to always tell the truth. And my parents told me to always serve with integrity and distinction and never to be ruled with fear in my decision making. So as much as the I Am movement is talking about Dr. De Maayer, it's talking about every single healthcare worker in South Africa.
And I know
we have been...
Sorry to jump in, just on the I Am thing, to explain to our viewers, I've noticed at the end of the letter, each one of you has said, I am, and your name, basically saying, this is who I am. If you want to come and victimize me, I'm out there. And this is an incredible show of solidarity. You put it so well that Tim De Maayer was the spark, but there are difficult conditions everywhere. I wonder if you could share your experiences. You're head of intensive care at the biggest hospital in the country. I think, in fact, it's the biggest hospital in the Southern Hemisphere, enormously pressurized. Talk to me about what makes it even more difficult than I would imagine it would be.
So, Sally, the I Am is to let people know who I am, the administrators, but also the public, to recognize who we are. Who are these people that are trying to improve things for them? As head of intensive care at Chris Hani Baragwanath, I am between the bottle and the label. We don't have enough ICU beds for that hospital. To give you an example, 8 to 12% of in-hospital beds should be critical care beds. We only have 36 beds for a 3,200 bedded hospital. So you can already see that my environment is fraught with conflict in trying to get patients into that intensive care. So I have to have tight triage principles. And you know, recently they've been talking about surgical cases being cancelled. Some of them are being cancelled because they need intensive care post-operatively, and if there is no ICU bed, they cannot be done because their lives will be risked, so that surgery has to be postponed.
So
that is just one factor.
Yeah, I mean, you are then in a position, you basically having to make life or death decisions all the time, and in the middle of that, we heard a few months ago that Chris Hani Baragwanath didn't have bread to feed patients, and medical staff were bringing food for patients. And then also, and I think you were referencing this just now, the DA's Jack Bloom is speaking about the cancellation of operations because of linen. I want to play that clip, and then we can chat afterwards. Let's take a listen.
Very strongly about is that a lot of operations were cancelled because of a lack of clean linen. Now, this is really very simple to arrange. How come after all these years, so many hospitals still have to cancel operations, and in fact, patients also go without clean linen? And this is because the hospitals have to get their linen cleaned by state laundries, which are very inefficient, and they don't do the job. So the MEC for Health confirmed that laundry problems were behind a lot of the cancelled operations, and she said that there were problems with boilers, and they planned to buy a new boiler. But honestly, the simple solution is just to allow hospitals to buy from private laundries. I think that would solve the problem, and we wouldn't have all this cancelled operations, causing immense distress both to staff and patients.
And I think that's the thing, Prof, is not only are you making literally life or death decisions, you're also having to deal with things that you shouldn't. Because if there isn't proper running water, or if there isn't bread to feed patients who are desperately ill, or if there isn't clean linen so someone can sleep in a comfortable bed at night, or perhaps even a bed at all, those things must get in the way and ultimately contribute to loss of life. Surely.
Yeah, but with all due respect, I have to address what Mr. Bloom is saying. He's playing opposition politics right now. Mm-hmm. Linen cannot be the major factor in cancelling surgery. It's just one of the factors. The surgeries are cancelled either because the patient is not fit for surgery or because the theatre infrastructure is not working, and then the linen can play a factor, equipment can play a factor. So let's not be selective in what we pick up.
So it's a myriad of problems, really.
A factor. But I face a lot of problems. All the other clinical departments face a lot of problems that hamper our work. We may be running out of drugs, medications. That also hampers our work environment. We are short-staffed. That hampers our work environment. So it's not just about running the ICU. It's also having to think about things that I wasn't trained for my specialty.
And Professor, let me just interject there, because when you have to do that, there's the risk you take your eye off saving lives, which is what you're there for. This is putting inordinate pressure on a public health specialist. You've written this letter, you've addressed it to the health minister and also the Premier of Gauteng. And it's interesting, you're also calling for CEOs to have operational and financial management skills. I mean, it staggers me that that isn't anyway a prerequisite for the job. What do you want them to do immediately? Because there are so many problems. It's budget cuts, it's lack of staff, it's the small things that get in the way, clean laundry, lack of bread. Clearly, supply chain management is a problem. What are the immediate action points you need as a collective in this I Am movement now?
Okay, number one, back off Dr. De Maayer. Number two, stop coming out of left field at us and get out of the denial mode. Stand up as a department and acknowledge you've got problems in the public healthcare sector. It is broken, but is not irretrievably broken down. Number four, acknowledge you have got excellent healthcare workers who are still willing to repair things. We can turn this ship around. This is the Titanic, and we have caught sight of the iceberg. We haven't hit it yet, or if we've hit it, the leak is moderate. we can stem the flow. Number 5, let's address the urgent matters now. Start working on filling those vacant, unfunded posts. You got the budget. What did you do with it? Health is always getting an increased budget. How are you distributing it? Why is there an inequity in distributing budgets when hospitals have different activities? Chris Hani Baragwanath Academic Hospital is your largest institution. But when you look at its budget, it doesn't make sense that it carries a budget that is almost equal to a hospital that is a third of its size. So let's start thinking like people who understand the healthcare environment. Stop appointing CEOs that know nothing about the healthcare environment. And let's stop cadre deployment. Okay? That is not helping us. It's not helping us. And, you know, we have seen things slide in public healthcare. But now we have caught sight of the fact that we're really going down this steep slope. And we need to apply the brakes now.
I have to ask you one last question.
Listen,
yes, and I hope you get a response soon. Professor, I'm risking this last question knowing I might have to rudely interrupt you because we're just waiting for the President to hand over the last part of the state capture report. I have to ask you, though, working at Chris Hani Baragwanath, the problems that you have listed tonight, has corruption been eradicated at Chris Hani Baragwanath? Are those systems at least clear of corruption, to your knowledge?
Okay, the people I work with at Chris Hani Baragwanath Hospital seem to be on the level. But you know the stories that have come out regarding PPE, not at our hospital, at our department, haven't been rosy and peachy. And it's just a shame that I'm competing with the President for time right now. Because I got loads of things to tell.
Yeah,
you know.
we certainly are going to have to catch up with you. One final question. I'm sure you're still waiting for a response from the Health Minister and the Gauteng Premier. What are you going to do as a group of healthcare professionals at the top of your league if you don't get an adequate response?
They're going to come back to us. I can share with you that right now we have colleagues wanting to know how they can sign up on that letter. And we're making an opportunity available for more healthcare workers to come in on the IM initiative.
All right. Well.
And it's not just going to be 132 of us.
132 and counting.
This is just a start.
Yeah, indeed.
Yeah,
as you say, Tim De Maayer was the spark, but there is much that has to be done. Professor Rudo Mathivha, head of intensive care at Chris Hani Baragwanath, she's in fact the first name on that letter. A group of over 130 healthcare professionals calling for urgent action on what is going on in Gauteng hospitals. We are, of course, you'll see that little box, waiting to hear from the President any moment now. We're going to take a short break. Also,